Good morning to all present here. Today we are going to discuss in detail about hydrocephalus. So what is hydrocephalus is? Hydro means water and cephalus means a head. So when there is accumulation of fluid in the head, that is in the brain, is termed as hydrocephalus. So here the water means the cerebrospinal fluid. When the cerebrospinal fluid is being accumulated in the ventricles of the brain, this condition is known as hydrocephalus. So hydrocephalus, the babies looks like this. The term hydrocephalus is derived from the Greek words hydro meaning water and cephalus meaning head. As the name implies, it is a condition which the primary characteristics is excessive accumulation of fluid in the brain. So this is a condition which involves, it is a congenital disorder and there is accumulation of fluid. So here we are going to talk about the fluid is cerebrospinal fluid. So definition is hydrocephalus is the abnormal accumulation of cerebrospinal fluid in the intracranial spaces. This definition is taken from the Rimple Sharma. And next is hydrocephalus is abnormal accumulation of cerebrospinal fluid in the ventricles and cavities of brain. This causes the increased intracranial pressure and inside the skull and may cause progressive enlargement of the head. This definition is taken from Padmaja. So there is the accumulation of fluid into the ventricles and the cavities of brain and causing the accumulation of fluid in the ventricles, and eventually it leads to the enlargement of the head. This condition is known as hydrocephalus. So where it is being accumulated? It is being accumulated in the cerebrospine. It is being accumulated in the cavities and ventricles of the brain. That is termed as hydrocephalus. We have to also assess for any other associated condition is there with this condition or not. So from the image itself we will be able to identify what the condition exactly is. So next we are going to see the difference between the non-hydrocephalus and hydrocephalus. So you can see on your left side the normal amount of CSF in the ventricles, whereas in the right there is the excessive cerebrospinal fluid in the ventricles of the brain. That accumulation causes the increase in the pressure. Here the pressure we are talking about intracranial pressure. The incidence is 1 to 3 of every 1,000 born children in worldwide. And cerebrospinal fluid, the normal amount of CSF is 150 ml. The CSF formed by choroid plexus and it is absorbed by the arachnoid villi. Normally 500 ml of CSF formed every day and an equal amount is absorbed. From this implies that how much amount of fluid is being formed, that much amount of fluid has to be get absorbed in the body. So normal circulation is lateral ventricle, third ventricle, fourth ventricle, central canal of the spinal cord, subarachnoid space, and then it is being reabsorbed by the arachnoid villi, that is reabsorption in venous sinus by arachnoid villi. So next is types of hydrocephalus: non-communicating hydrocephalus or obstructive, communicating hydrocephalus or non-obstructive. We'll see in detail. Communicating hydrocephalus. The communicating hydrocephalus is a condition that results when the arachnoid villi are unable to adequately reabsorb the cerebrospinal fluid. From before slides we have seen that when a particular amount of cerebrospinal fluid is formed, that the equal amount has to be reabsorbed. So in communicating hydrocephalus there is the disturbance in the absorption. There is reabsorption of cerebrospinal fluid in the arachnoid villi, causing the type of hydrocephalus is communicating hydrocephalus. So this condition we have two. The communicating hydrocephalus, otherwise known as non-obstructive hydrocephalus. There is no any obstruction. Next we are going to see the non-communicating hydrocephalus. A non-communicating hydrocephalus is a condition that results when the ventricular system does not communicate with the arachnoid villi due to some obstruction in the normal pathway of the CSF flow. So consequently CSF is produced in the ventricular system, but there is an obstruction causing the failure in the reabsorption of the cerebrospinal fluid. Non-communicating hydrocephalus, otherwise known as obstructive. Etiology of hydrocephalus is congenital and acquired. In congenital, intrauterine infections, mainly rubella, toxoplasmosis, cytomegalovirus. Congenital brain tumor, intracranial hemorrhage, congenital malformation of the arachnoid villi. So these are the etiological causes of the hydrocephalus, that is from the congenital, that is from the birth the baby will have these conditions causing hydrocephalus. Acquired is inflammation, trauma, neoplasma causing occupying lesions like tuberculoma, subdural hematoma or abscess, gliomas, empedymoma. And connective tissue disorders like Hurler syndrome, achondroplasia, degenerative atrophy of brain, that is when there is a due to trauma or infection there will be a change in the normal anatomical and physiological functions of the brain that causes the accumulation of CSF. So the clinical manifestation, from the first image itself it is very clear that the baby will be having unusual large head, a rapid increase in the size of the head, a bulging or tense soft spot fontanelle on the top of the head, that is Mason sign, or another sign is a sunsetting of the eyes, that is eyes fixed downward. Shiny scalp with a prominent scalp vein. So these are one of the clinical manifestations, like the Mason sign is otherwise known as cracked pot sign. So these all are the clinical manifestations of the hydrocephalus. So sunset means how the sunset will be. In the same manner, the eyes of the baby will also look like a sunset of the eyes, and the Mason signs, eyes to fix down to the sunset of eyes, everything is a so in this image it is very clear that the baby is having a sunset of eyes. You can see now the baby is seeing the downwards. So this is the very prominent and cardinal features of the hydrocephalus when a baby is having, so this is the cardinal features of the hydrocephalus. The other clinical manifestations like poor feeding, seizure, deficits in the muscle tone, strength, vomiting, sleepiness, and very irritable, that is they will be very irritably crying. So next is diagnostic evaluation. We will be doing the physical examination, positive trans-illumination of the infant head, typical cracked pot sign, that is a Mason sign of the skull bone, ophthalmoscopy to identify any abnormalities in the eyes, magnetic resonance imaging, computed tomography scan, cranial ultrasonography and X-ray of the skull. So these are the diagnostic evaluation that So these all are the diagnostic evaluations of the hydrocephalus. So next we are going to see in detail about the other diagnostic evaluations like lumbar puncture, that is insertion of spinal needle into the subarachnoid space between the lower lumbar vertebrae. So by collecting the cerebrospinal fluid, we will be able to identify what are the infections is there or not. So next we are going to see in detail about the medical management. The medical management, that is reducing the intracranial pressure, prevention and management of complication, managing problems caused by pathology. Medical management includes the use of osmotic diuretics and loop diuretics to reduce the cerebrospinal fluid production. Medical management is temporary relief only, but the main management is surgical management. So as a nurses and as a medical care professionals, our main intention is reducing the cerebrospinal fluid accumulation and also reducing the intracranial pressure caused due to the accumulation of the fluid. So our prime function is to reduce this ICP by giving some nursing management and preventing the complications in the babies and reducing all the associated symptoms and also administering the loop diuretics. So next, the main and foremost management for the hydrocephalus is surgical management. That is, a shunt is made up of a radioplastic and has ventricular catheter, pressure valve, pumping chamber and a distal catheter that directs the flow of the cerebrospinal fluid from the ventricles to other areas of the body from where it is absorbed. So that is known as, in a simple term, by using the mnemonic PAPU, that is ventriculoperitoneal, ventriculoatrial, ventriculopleural and ventriculoureteric. So by providing this shunting procedures, we are going to bypass the fluid being. So these are all the shunting procedures. That is, first we'll see one by one. That is endoscopic third ventriculostomy, choroid plexectomy, ventriculoperitoneal shunt, that is VP shunt, ventriculoatrial shunt, ventriculopleural shunt, and ventriculoureteric shunt. So we'll see the image now. That this is known as ventriculoperitoneal shunt, where the fluid being accumulated in the ventricles of the brain is being bypassed through the peritoneal cavity. That is, the fluid is being collected in the ventricles of the brain is being collected in the peritoneal cavity in order to reduce the ICP. So next is a ventriculoatrial shunt, that is known as the fluid is being accumulated in the chambers of the heart. This is the ventriculopleural shunt, that is, the fluid is being accumulated in the pleural cavity. So next is endoscopic third ventriculostomy. It is an alternative procedure for the shunting procedures when we are not indicated to do the VP shunting. We will be doing the third ventriculostomy to the babies. That is the hole in the floor of the brain, allowing the trapped cerebrospinal fluid to escape from the surface of the brain where it can be absorbed instead of inserting a shunt. So from this itself we can identify that it is alternative procedure for the shunting procedure, where there is a hole is being made in the floor of the brain, allowing the fluid being collected in the ventricles of the brain is drained out and it is being sent to the place where it is getting absorbed. So some of the warning signs when the VP shunt is done, if the shunt is not working properly, there will be some warning signs, no? That is known as headache, that is, the baby will be very irritated and crying, and also vomiting, that is throwing up, with little or no nausea, feeling sick to his or her stomach. Changes in the personality, for example, a child who is easy to deal with becomes very hard to handle all of a sudden, or is just not acting right. So swelling of the skin that runs along the path of the VP shunt, a bulging soft spot on the child's head, vision problems, loss of some mental and physical abilities. So these all are some of the warning signs of the VP shunt if it is not. So VP shunt infection is a shunt infection occurs when a bacteria infect the tissue around the VP shunt. When the tissue is infected, it can cause a VP shunt to stop working properly. The shunt that does not work well can cause an increase in the pressure within the brain. This increase in pressure can damage the brain or threaten the child's life. So we have to be very sure and we have to be very careful in the caring of a child after the surgical procedure, that is VP shunting, in order to prevent the shunt infection, and also we have to closely watch the baby, that is around the clock, for any warning signs of the VP shunting. So next we'll see about the prognosis. It depends upon the early diagnosis and the prompt therapy. With the improved diagnostic and management techniques, the prognosis is becoming considerably better. So approximately 2/3 of patients will die at an early age if they do not receive the surgical treatment and the prompt time. So some of the complications is seizure, herniation of the brain, spontaneous arrest due to natural compensatory mechanism, persistent increase in ICP and brain herniation, developmental delay, and depression. So nursing managements are: explain the family about the management required for the disorder, provide the preoperative nursing care, assess the head circumference, fontanelles, cranial sutures and level of consciousness, check also for irritability, altered feeding habits and a high pitched cry. So why we have to assess the head circumference? Because if there is accumulation of fluid, day by day it increases the head circumference. For that reason only we have to assess the head circumference of the baby on a daily basis, and also we have to assess the fontanelles, that is if there is a soft spot, fontanelles is there or not, like that. Then we have to assess the cranial sutures. Then the nursing care, like firmly support the head and neck when holding the child, because the head is going to be very heavy. Provide the skin care for the head to prevent the breakdown. Give a small frequent feeding to prevent the risk of vomiting. Provide post-operative nursing care. Assess the signs for increased intracranial pressure and fever, redness. Prevent the infections. And we have to provide the physical needs like maintain the personal hygiene, prevention of skin breakdown, prevention reduction of deformities, maintenance of the ideal weight, change the positions frequently for the better nursing care. Next, physiological needs: prevention of injury and infection of sac, provision of adequate nutrition, prevention of infection of urinary tract. Psychological needs like relieve anxiety of the parents, maintain the psychology of the parents. So this all the nursing care we are going to provide